So I had a great question and follow up to my last video, which was about intrusive thoughts for moms, especially in pregnancy and postpartum. So the question was, what causes these intrusive thoughts? So again, my name is Hannah Balo. I'm a family nurse practitioner. I am certified in perinatal mental health, and that is my passion. So what causes these intrusive thoughts? So women during pregnancy and postpartum are more likely to have intrusive thoughts because these become more significant and feel louder, feel more real, more sticky in times of stress, in times of life changes, in times where we are lacking sleep. So, which is often in the postpartum time, in pregnancy too. So that's why we can have these more. They might be the first time we notice them, or they might be the first time they feel really loud, is because we are just more likely just because of some of those things that we're dealing with in this time as moms. But it is actually our brain's way of trying to protect us that sometimes becomes overly protective and not helpful but harmful in that time. There is a structure deep in the brain called the amygdala. Its job is to keep you safe. It does not care about keeping you comfortable. Its job is to keep you safe. If there is any threat of danger, it will send off the alarm system. Um, so it's very helpful when there is actually a threat of danger. So for instance, my daughter recently, I told her to get in the side door of the van. She proceeded to run towards the street. So my amygdala sent that message, that fight, flight, or freeze, that there is um, there is something that you need to be worried about. There is a threat of harm. So my adrenaline increases, my heart rate increases. I was able to move very quickly to grab her and get her back into the car, which was great. That's a great example of how the amygdala and how our fight, flight, or freeze response can be really helpful. That's what it's for. But as I said, it does not care about keeping you comfortable. It will always, always try to protect. It would rather send those alarms out, even if there's no danger, instead of possibly not sending the alarm if there is danger. So, an example of when that amygdala might fire and it might be a false alarm. So it's not a real alarm. There's actually no threat of danger, but the amygdala doesn't know that. It works so fast. It sends that message so fast that we don't have a lot of time to decipher if this is a real or not a real threat. So one of the examples of when your brain is trying to be protective, but it really goes into overdrive and actually becomes harmful because there's actually no threat of danger, was one of my intrusive thoughts in my postpartum time was that I would possibly leave my baby in a hot car in the car seat because I had read a story of someone who had done this. Of course, it was an accident. They didn't mean to, and it was a tragedy. Um, but that sent the alarm to me that I needed to be afraid of this when actually I didn't need to be afraid. Yes, I need to be aware, I need to be responsible, but I already was. Um, this was not actually a real threat that I would do this. But because I read that story, that came into my mind as this is a threat. You need to be overly protective and overly cautious of this. As you give in more to something that is not a real fear, it can become more significant, it can grow, and there's sometimes never enough that you can do to satisfy. Um, so I would, of course, check the car seats, but then that didn't even feel like enough. I would take pictures of the empty car seats. And then when I was in a building, in a meeting, talking to someone, I would be thinking about is, did I get my kid out of the car seat? Are they actually with someone? Are they actually in a safe place? Pull out my phone, look at the pictures, to make sure I was being responsible. So that is an example of when your amygdala is firing. Um, they are sending that warning, but that's a false alarm. That is not something um, that we need to listen to. But it can be very hard because it happens so quickly. So there are so many things we can do. There's so much hope. Um, Thankfully, the brain is amazing and can actually be rewired, and there are so many hopeful, helpful things, to do as moms, for intrusive thoughts. But I just wanted to share that because I feel like knowledge is power, and when I learned that about what is actually going on in my brain, it was really helpful for me to kinda take a step back and see, this is what's actually going on. This is not a real threat. So I hope that's helpful.